Hi everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're continuing our series on hereditary angioedema, or HAE, a rare and potentially life-threatening condition marked by unpredictable swelling attacks that can involve the skin, gastrointestinal tract, or even the airway. Because these attacks result from a deficiency or dysfunction of C1 esterase inhibitor, long-term prevention through C1 esterase inhibitor replacement has long been a well-established and effective strategy for many patients. So far in this series, I have covered FDA-approved preventive options, including biologic therapies such as Haegarda and Andembry, an RNA-targeted therapy like Ganzera, and an oral preventive option, Orladeyo. If you have not seen those episodes yet, you'll find the links in the description below. Today, our focus shifts to Haegarda, the FDA-approved subcutaneous C1 esterase inhibitor replacement therapy for HAE prevention. Even as newer preventive therapies have entered the field, Haegarda remains a highly effective and reliable option for both children and adults. In this video, I will walk you through 5 key things you need to know about Haegarda, what it is, how it works, how it's administered, important warnings and precautions, and what we know about its safety profile. And if you're new here, don't forget to like, subscribe for more evidence-based medical updates. Now, let's dive in. First, what exactly is Haegarda and who it's for? Haegarda is a human plasma-derived C1 esterase inhibitor approved by the FDA for routine prophylaxis to prevent HAE attacks in patients 6 years of age and older. Unlike on-demand therapies used when swelling begins, Haegarda is administered on a scheduled basis to reduce attack frequency and severity over time. Haegarda was initially approved in June 2017 for patients 12 years and older, with an expanded indication in September 2020 to include children as young as 6 years. For patients experiencing frequent, severe, or disruptive attacks, long-term prophylaxis with Haegarda can meaningfully reduce disease burden and improve quality of life. One important reminder: Haegarda is not a rescue medication and should not be used to treat acute HAE attacks. Patients should follow their individualized on-demand treatment plan for breakthrough swelling. Second, how does Haegarda work? To understand Haegarda's mechanism, we need to revisit the underlying biology of hereditary angioedema. In healthy individuals, C1 esterase inhibitor plays a critical regulatory role across several inflammatory-related cascade systems, including the complement system, the contact system, and components of the coagulation and fibrolytic pathways. In patients with HAE, C1 esterase inhibitor is either deficient or dysfunctional, allowing unchecked activation of plasma kallikrein. This overactivation leads to excessive production of bradykinin, the primary mediator responsible for increased vascular permeability and tissue swelling in HAE. Bradykinin causes blood vessels to leak fluid into surrounding tissues, producing the characteristic swelling attacks seen in this condition. Haegarda works by replacing the missing or non-functional C1 esterase inhibitor. Once administered subcutaneously, the infused C1 esterase inhibitor restores inhibitory control over plasma kallikrein, reducing downstream bradykinin generation. By stabilizing this pathway, Haegarda lowers baseline attack risk and maintains consistent protection against swelling. Third, let's talk about dosing and how Haegarda is administered. Haegarda is given as a subcutaneous injection after reconstitution and is intended for self-administration or caregiver administration once proper training has been completed. The recommended dose is 60 international units per kilogram of body weight, administered twice weekly, typically every 3 or 4 days. Haegarda is supplied as a freeze-dried powder in single-dose vials and must be reconstituted with still water before use. Each kit includes the Haegarda vial, still water for injection, and the mixed 2 vial filter transfer set. The medication is available in 2 vial strengths: 2,000 international units reconstituted with 4 ml of still water, and 3,000 international units reconstituted with 5.6 ml. Step-by-step preparation and injection instructions are provided in the instruction for use section of the package insert and on Haegarda.com. Injections should only be performed after the patient or caregiver has been properly trained by a healthcare provider. That said, a few practical points are worth highlighting. Once reconstituted, Haegarda should be used within 8 hours and should not be refrigerated or frozen. Each vial is for single use only, and any partially used vial should be discarded. Injections are typically administered into the abdominal area or other appropriate subcutaneous sites, such as the upper arms or thighs, with careful rotation to avoid repeated use of the same site. New injection sites should be at least 2 inches away from the previous site, and injections should be avoided in areas where the skin is swollen, painful, bruised, red, itchy, or scarred, including areas with stretch marks. The injection rate may be adjusted based on patient comfort. If a prescribed dose requires more than 1 vial, each vial should be reconstituted separately using a new transfer set and diluted, and the contents may be poured into a single syringe before administration. Haegarda should not be mixed with other medicinal products. Patients should contact their healthcare provider if a dose is missed and plan ahead before traveling to ensure an adequate supply. A new needle should be used for each injection, and needles should never be reused or shared to reduce the risk of infection. Fourth, let's review important warnings and precautions. Severe hypersensitivity reactions may occur with Haegarda. Signs and symptoms may include localized or generalized hives, chest tightness, difficulty breathing, wheezing, hypotension, or anaphylaxis during or after injection. Haegarda should not be used in patients with a history of life-threatening reactions to C1 esterase inhibitor products. Call the healthcare provider or seek emergency medical attention right away if developing symptoms such as wheezing, trouble breathing, chest tightness, bluish discoloration of the lips or gums, fast heartbeat, facial swelling, rash, or hives. Epinephrine should be readily available, and patients or caregivers should be trained in its use. Thromboembolic events have been reported in patients receiving C1 esterase inhibitor products, including Haegarda. Although a causal relationship has not been established at the recommended subcutaneous dose of Haegarda, very high doses of C1 esterase inhibitor can increase the risk of blood clots. Patients should inform their healthcare provider if they have a history of cardiovascular disease, stroke, blood clots, or have thick blood, indwelling catheters, or access device in one of the veins, have been immobile for some time, or use medications such as certain birth control pills or androgens. Symptoms such as limb swelling or pain with warmth over the affected area, discoloration of an arm or leg, unexplained short of breath or rapid pulse, chest pain or discomfort that worsens on deep breathing, or numbness or weakness on one side of the body should prompt immediate medical attention. Because Haegarda is derived from human plasma, it may carry a risk of transmitting infectious agents, including viruses and theoretically prion diseases such as CJD or other pathogens not yet known or identified. Extensive donor screening, viral testing, and multiple manufacturing steps are used to reduce this risk, but it cannot be completely eliminated. And finally, let's review side effects and safety. In the pivotal clinical trial, the most common side effects were injection site reactions such as pain, redness, and swelling, hypersensitivity reactions including itching and rash, nasopharyngitis with symptoms like runny or stuffy nose, sneezing and watery eyes, and dizziness. Long-term safety data from an open-label study were consistent with findings from the controlled trial experience. Importantly, 95% of injection site reactions were mild in intensity, and 83% resolved within 1 day. No injection site reactions were serious or led to treatment discontinuation. One patient discontinued Haegarda due to a treatment-related adverse reaction of urticaria. In pediatric patients aged 8 to under 17 years evaluated in the pivotal trial and the open-label extension study, the safety profile was comparable with the overall study population. And there you have it, 5 key things you need to know about Haegarda, the only subcutaneous C1 esterase inhibitor approved for prophylaxis of hereditary angioedema attacks in patients 6 years and older. By physiologically replacing what patients lack and addressing the root cause of the disease, while allowing for convenient home administration, Haegarda remains a foundational preventive option in modern HAE management. With this episode, we've now covered 5 of the 6 preventive therapies currently approved for HAE, including Takhzyro, Orladeyo, Danzira, and Dembry, and now Haegarda. The only one left is Cinryze, another C1 esterase inhibitor replacement therapy. However, because Cinryze requires intravenous infusion, its convenience and real-world use are limited. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.